considering the very limited time I have at my disposal, I will go straight to the abstract review presentation. All protocol duly observed. My name is Adefemi Oluwasegun, a biomedical engineer from University Teaching Hospital, and I'm currently undergoing my postgraduate study in biomedical engineering in the University of Ibadan. This morning I'll be talking on artificial stem cell technology for cancer care innovation in resource-limited care setting. I want to bring out the slides. Next slide. Why does artificial stem cell matter? The background and rationale. I'll be speaking on cancer. It is a well-known everyone of healthcare practitioner that cancer is a bothersome health challenge. And in 2022, over 20 million cases was recorded, and over 9 million cases of death was actually recorded. And current limitation that borders on the mode of treatment ranging from radiotherapy, chemotherapy, and even surgery has to do with toxic side effects of the drug being used and drug resistance to heterogeneity and relapse. Because this cancer we are talking about is not actually caused by a particular cell. It could be multi-cell that results to this cancer. So we've brought a kind of innovation which actually the bedrock of such innovation is induced pluripotential stem cell. What do we mean by stem cell? Stem cell now can be gotten from embryo. It can be gotten from umbilical cord. But in this case, because of the ethical condition that surrounds the embryonic stem cell, tampering with the fetus, we've come to realize artificial stem cell, which is the one commonly used is the induced pluripotential stem cell. Let me make this allegory. Imagine a situation whereby a person has become a doctor, but during the process of becoming a doctor, he was exposed to so many adverse effects, and as such, there was distraction and all that. He was unable to function very well. There is need to reprogram such kind of an individual so that we're able to function very well. So that's what induced pluripotential stem cell does. You harvest your somatic stem cell, which is adult stem cell, then you reprogram it, making use of Yamanaka factor, to a stem-like state that you're able to engineer it and to become whatever we want it to become. And this is the bit to actually treat the tissue that has, been affected. So that result to artificial stem cell, a transformative platform for the future of cancer care. So the objective of this study is to explore recent advances in artificial stem cell technology and their potential application in improving cancer care in resource-limited care setting like in Ekiti State and Nigeria at large. So next slide, please. So, like I said, methodology I deployed is the use of literature review, and my findings, we've discovered that it's through artificial stem cell we could remodel our diseases, drug discovery, immune therapy, target drug delivery, and tissue regeneration. Because of my time, next slide. So the implication of this for healthcare practice, despite the advantage inherent in this pluripotential stem cell, we have cost, infrastructure, technical expertise, regulatory issue, and the future perspective and the potential inherent in this pluripotential stem cell in the cure of cancer. We have artificial intelligence, and machine learning is able to make use of what we call to analyze biological data to predict future what have you. Then we have CRISPR gene editing, known as biological scissors. Then we have the 3D bioprinting digital twins, personalized medicine. Then conclusively, it has been established already that stem cells are transforming cancer research. Biomedical engineering is central to this translation process. Then collaboration, the nurses, the doctors, the medical laboratory scientists, should come together, to take care of cancer care. And my final message concerning this topic is stem cell technology is a major breakthrough in modern cancer therapy. Beyond that, we see cardiovascular disorder, organ regeneration, diabetic, in which this artificial stem cell has been used, to treat. Thank you.
All right, thank you so much, sir. You can please take your seat. Your phone. All right, thank you. They are loaded, and of course, you know that we have limited time. So thank you so much. All right, the next person is Adetoroju Racheal Temiloluwa. For the next 3 minutes, please let's have you.
Thank you very much for the opportunity. My name is Adetoroju Racheal Temiloluwa, and I'm a graduate of the University of Ibadan, practicing in Federal Medical Center as a medical laboratory scientist. And in line with the theme for this year's Healthcare Professionals Conference, I'll be presenting a paper titled "Beyond the Results: Empathy, Ethics, and Patient Experience in Medical Laboratory Practice." Laboratory medicine is a very, very interesting field, and this was a branch that was kind of obscure, limited interactions with our. But in recent times, this is fast becoming a thing of the past. And then medical laboratory professionals play a vital role in patient care through the generation of accurate and reliable diagnostic results. However, for many patients, their most direct encounter with us occurs during specimen collection and other routine interactions with laboratory personnel. And while these interactions may actually seem brief, they color patients' perspective about healthcare delivery generally. So, while they may be brief, as I said, they often influence how patients perceive both the laboratory and the healthcare system in general. In recent times, actually, concerns have been raised about patient experiences that are perceived as being unfriendly, dismissive, or lacking empathy. Although, to be sincere, most of these encounters occur in places where they have high patient load, but still, they should not be ignored. So now, what's the objective of this paper? The objective is to examine the place of empathy in medical laboratory practice and explore how healthcare professionals can maintain compassionate patient interaction while still upholding ethical standards and professional boundaries. This might seem like an Herculean task, because how can you be empathic or upholding your ethics? Now, the approach that this paper took is drawing from observations from routine medical laboratory practice and then discussing common situations that have encountered during patient care. And this actually includes interactions with anxious patients, communication challenges during specimen collections, and the pressures associated with high patient volumes. And also, this presentation also considers how factors such as burnout, workload pressure, and compassion fatigue may affect patient interactions and professional conduct. Now, what are the findings of this paper? We have found that patients value respectful communication when you speak to them like they matter, which they do. And also, they also value clear explanations and professional conduct during laboratory encounters. And then simple acts that some of us take for granted, like active listening, providing reassurance, and communicating procedures, clearly can improve patient experience and cooperation. However, empathy must be exercised within ethical and professional limits to avoid inappropriate involvement, breaches of confidentiality, or actions outside the scope of laboratory practice. It is not in the place of laboratory professionals to interpret results for their patients. You just direct them to the appropriate quarters, and the doctor will get this done. So, to conclude, empathy and ethics are complementary aspects of quality laboratory practice. They work hand in hand, and maintaining compassion in patient interactions while observing professional boundaries promotes trust, strengthens professionalism, and contributes to a more positive healthcare experience. As healthcare professionals continue to navigate increasing workload demands, deliberate efforts to foster ethical and empathic practice remain essential. Thank you very much.
All right, thank you so much. Okay, moving on now. I have the honor and the privilege to invite here the lead paper reviewer, the person of Professor Taiwo Raimi. He's a consultant physician endocrinologist, Ekiti State University Teaching Hospital. People, please put your hands together for Professor Taiwo Raimi.
Good afternoon, everyone. Standing on the existing protocol, I want to appreciate us for the privilege to be here. I want to appreciate Daddy and all the other invited guests. Well, being the maiden edition, few abstracts were submitted, but I believe that from now on, there's going to be improvement. More people will be submitting abstract for this kind of conference. Maybe the notice was short, and just like the representative of the CMD spoke earlier, and which was also re-echoed by the the president of YPF in Ekiti State, that this is going to be an annual event. So just make up your mind that next year, when we are organizing it, you will be presenting abstract. Where 3 abstracts were submitted, 2 presented. The third presenter is not here, but I will still highlight what the present. So the first presentation borders on the use of stem cell, artificial stem cell, in managing cancer. And we all know that the burden of cancer is very great, not only in Nigeria, but worldwide. And people are looking for ways of improving the care of patients with cancer and also improving the outcome of care. And that is why artificial stem cell technology is very, very important. It's already being practiced. And I know there are some centers in Nigeria where this Lord. The lesson here is that we need to be innovative, we need to be creative, and we should not think that we have arrived. There are so many areas that we need to explore. And I believe that as young professionals who have contact with God, we are the kind of people that God would like to use to help bring solution to the malady that is afflicting human race. The second abstract talks about beyond the test result, empathy, ethics, and patient experience in medical laboratory practice. We know the importance of medical laboratory science in healthcare. For sometimes the scientists will say that while other healthcare workers are sleeping, we are still looking at the patient, isn't it? Yes, it is. Now, as the presenter said, the contact that laboratory scientists normally have with the patient appear to be very, very short. But I think from that presentation, there should be reorientation. We need to design our system in such a way that the laboratory scientists should have more time with the patient. Even before undergoing the test, there should be time for counseling. I know in many centers, such is not in existence. I don't think we have a counseling room as part of a laboratory setup. But I think it's very, very important that we begin to look at that. There should be a counseling room. Even before you do the test, before you take the blood, before you take the blood test or any specimen at all, the patient needs to be sit down and counsel on what you want to do and what to expect. This is very, very important. I know in HIV care is well established, but we should go beyond HIV and what is usually done in the HIV care. It should be extended to other aspects of laboratory science. Because when patients are coming to the hospital for tests, they are very, very anxious. They have a lot of questions. I don't know where this will lead me to. I don't know what the outcome is likely to be. And after that, what will happen? So we need to allay the anxiety of the patient. And that is why it is it is necessary to include counseling as part of the services that the laboratory scientists offer the patient. The last one, which was not actually presented, borders on supporting well-being and fulfillment in assisted reproductive health care, lesson from clinical experience in an IVF center. Now, this is very, very important, especially in the context of the theme of this conference. When we look at IVF care, what most people concentrate on is the outcome. How many babies? What are the success rates? That is what most people concentrate on. Am I right, sir? The gynecologists. Yeah, they want to know about your center. What is the success rate? But this paper is saying that we should look beyond that. The people who are behind that success need to be cared for. Are they fulfilled? Because many of them are also anxious. We have competitions. Of course, patients with fertility, they have many issues, psychological issues. And you want to allay that. And in place of doing that, even the health caregivers in the IVF centers, they are also anxious. And some they are emotionally drained. So the paper is saying that we should create an environment that will support the health of the caregivers, not just concentrate on the success rate. Remember what we were told by our keynote speaker, that a healthy health caregiver is one that can heal. If the health caregiver is not healthy, how can that health caregiver heal? So we should look at the well-being of the health caregiver, starting from the gate man, the health attendant, the laboratory scientist, the nurse, the pharmacist, the doctor. All the people who are in that setup need to be cared for. We need to provide enabling environment for their well-being, for their professional development, so that they can be fulfilled. When they are fulfilled, they will be able to give their best. Just to summarize, I want to suggest that next year, more people should send abstracts. Between now and then, begin to work. We need researchers. Just like our keynote speaker said, some people are in medicine or in healthcare profession not because they really desire to. Somebody suggested it to them. And some people are looking for a way out. Well, I need to tell you that in healthcare, the only thing you do is not treat patients or attend to patients. Research is part of the work. And some are just research. Maybe you are there, you think that, oh, I need to leave this setup, this emotionally draining, interacting with patients. I don't think I want it. Healthcare research is an aspect that you should think about. Maybe God wants you to go to that area. And I want you to know that the Holy Ghost is the best researcher. So if you are in contact with him, he will give you ideas that will bring problem of the world. Thank you very much for listening.
All right, thank you so much, sir.